Are you struggling to grasp psychosis behavior? If yes, hold your water. We have got you covered. Psychosis behavior is an interesting and complex topic. Psychologists, researchers, and healthcare professionals have studied it for a while. Psychosis is a condition that affects mental health and causes individuals to perceive or interpret things differently than others. Psychosis could cause hallucinations or delusions. Understanding this illness allows you to discover its causes and find appropriate treatments. Understanding psychosis behavior improves empathy, stigma reduction, early detection, and therapy. Without any further delay, let's dive deep into the details. Defining psychosis behavior. Psychosis is a group of symptoms that affect the mind and cause a person to lose touch with reality. When someone has a psychotic episode, their thoughts and perceptions get messed up. They might have trouble telling what's real and what's not. Differentiating psychosis behavior from normal behavior. Understanding the difference between psychosis and normal behavior can be difficult because it requires understanding how the person usually behaves. Some signs can help differentiate between the two choices. This condition, psychosis, causes ongoing hallucinations, extreme paranoia, issues with speaking and behaving, and trouble with work and social situations. You must seek medical assistance as soon as possible if you or someone else you know has these symptoms. Causes and risk factors of psychosis behavior. Psychosis cases vary, and their exact cause is not always clear. Some illnesses can cause psychosis. Let's discuss what causes and increases the risk of psychosis behavior. This section will teach you how biological and environmental factors can contribute to cause psychosis behavior. 1. Biological factors. Genetics and family history. Genetics and family history could be a factor. If someone in your family, like a parent or sibling, has a psychotic episode, you are more likely to develop one too. Certain genes, such as those that affect dopamine regulation, have been linked to a higher likelihood of being affected. Neurochemical imbalances. Neurochemical imbalances, especially dopamine imbalances, have been linked to psychosis. Dopamine is a neurotransmitter that influences mood, motivation, and cognition. Excess dopamine activity in specific brain regions, such as the mesolimbic pathway, has been related to positive psychotic symptoms such as hallucinations and delusions. Brain structure and function. Scientists have noticed that people who experience psychosis differ in how their brains are structured and work. Magnetic resonance imaging (MRI) studies have shown that certain brain areas that are responsible for perception, emotion, and cognition differ in size and connectivity. Differences in the structure and function of the brain can impact how it handles information and may play a role in the development of psychotic symptoms. 2. Environmental factors. Substance abuse. Psychosis is connected with substance abuse, especially the use of drugs and alcohol. Certain substances, like cannabis and hallucinogens, can trigger or worsen psychotic episodes. Long-term substance abuse may also raise the chance of developing chronic psychotic illnesses. Trauma and stress. Experiencing traumatic events like childhood trauma, losing a loved one, sexual assault, or war can all contribute to the development of psychosis. Experiencing ongoing chronic stress, like financial issues, can also increase the risk of psychosis. Social isolation. As social beings, humans thrive on connection and interaction with others. You might be more likely to have strange experiences if you have fewer friends. Feeling lonely, distressed, and low self-esteem can be caused by isolation. Remember, having no support system can harm your mental health. Types of psychotic disorders. 1. Schizophrenia. Symptoms and diagnostic criteria. Its symptoms usually appear in late adolescence or early adulthood. To be diagnosed with schizophrenia, the DSM-5 requires the following criteria. You must have at least 2 of the 5 main symptoms. The symptoms include delusions, hallucinations, difficulty speaking clearly, unusual movements, and negative symptoms. Subtypes of schizophrenia. Schizophrenia has subtypes such as paranoid, disorganized, catatonic, undifferentiated, and residual. These subtypes help doctors to diagnose and plan treatment. Different subtypes have different symptoms and severity levels. Treatment options and management strategies. Doctors usually treat schizophrenia with a personalized combination of talking therapy and medication. Community mental health teams, CMHTs, usually treat most people with schizophrenia. The CMHT aims to offer regular assistance and care to help you maintain your daily routine and freedom as much as possible. 2. Bipolar disorder with psychotic features. Relationship between bipolar disorder and psychosis. When someone has bipolar disorder with psychotic features, They suffer typical bipolar disorder mood swings, as well as hallucinations or delusions. These symptoms are often related to the person's mood state. During manic episodes, people may experience grandiose delusions or auditory hallucinations, while during depressive episodes, they may experience nihilistic delusions or somatic hallucinations. When someone with bipolar disorder also has psychosis, it can complicate things and cause more problems. They may feel more upset and have a harder time functioning. Symptoms and treatment approaches. Symptoms include hallucinations and delusions. Individuals struggling with mental health conditions can benefit from psychotherapy, specifically cognitive behavioral therapy. This type of therapy can assist individuals in managing their condition and developing effective coping strategies. The typical course of treatment involves the administration of mood stabilizers or antipsychotic medications to manage symptoms of mood and psychosis. 3. Other psychosis-related disorders. Brief psychotic disorder. This involves an episode of psychotic behavior that lasts relatively briefly. 1 day to as long as a month is the range of possible duration for a brief psychotic episode. A stressful situation is frequently the cause of this condition. Schizoaffective disorder. This condition is like schizophrenia, but involves major mood episodes such as major depressive disorder or bipolar disorder. Delusional disorder. Delusional disorder is a condition in which a person strongly believes in things that are not real, even when shown evidence that contradicts their beliefs. Treatment and management approaches for psychosis behavior. 1. Medications for psychosis. Antipsychotic medications. Doctors normally suggest antipsychotic medicines as the first treatment for psychosis. They stop dopamine, a chemical that sends messages in the brain, from working. Antipsychotic medications can reduce hallucinations and delusions and improve clarity of thought. The antipsychotic medication that a doctor prescribes will vary depending on your symptoms. Sometimes, people only need to take antipsychotics briefly until their symptoms become more manageable. Some individuals may need to take them for a longer period. Side effects and considerations. Like every coin with two sides, antipsychotic medications also have potential side effects. Side effects can include shaking and trembling, drowsiness, weight gain, restlessness, and blurred vision. Not everyone will experience these side effects, and their severity will also vary from person to person. Talking openly with your doctor, who prescribed the medication, is very important. This conversation with your doctor helps you properly track and manage any side effects. 2. Psychotherapy and counseling. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, is a talking therapy that helps to manage your issues by changing how you think and behave. This therapy includes regular meetings with your mental health counselor. It is the most useful therapy for treating psychosis symptoms that can't be managed with only medication. According to research, incorporating cognitive behavioral or family psychotherapy within the treatment can improve functional outcomes. Family therapy. Family therapy reduces the need for hospital treatment for people experiencing psychosis. This therapy helps everyone in the family to learn to cope with this mental health problem and work together to heal. It includes the requirements of everyone in your family and their interactions with one another. It promotes family unity, which is essential to create a healing environment for the patient. Support groups. Join support groups online and offline to have peace and calm. These communities allow you to connect with others who share their experiences and learn from each other while receiving emotional and practical support. Remember one thing: you are not alone in this race, so don't lose hope. 3. Lifestyle and self-care strategies. Stress reduction techniques. Stress management is crucial for people with psychosis symptoms. Meditation, deep breathing, and mindfulness can improve stress and emotional health. Don't forget that a calm mind is a powerful mind. Healthy lifestyle choices. If you want pink of health, it is necessary to improve your health by making healthy lifestyle choices, like getting enough sleep, eating right, staying active, and not smoking. A positive lifestyle can support recovery and help manage symptoms effectively. Social support networks. Build a strong social network. Inspire others to participate in the activities that bring them joy. Join groups that allow you to meet others who share your interests and concerns and form meaningful relationships with those people. Remember that a problem shared is a problem halved. Reaching out to others can bring important support and understanding. Conclusion: psychosis behavior. To wrap things up, studying complicated psychosis behavior has helped us understand a topic that can be confusing. When we understand how biological and environmental factors interact, we can better understand how this condition functions. Our genes and chemical imbalances are connected like puzzle pieces. People dealing with psychosis behavior can find hope through treatment options such as medications, therapy, and support groups. Remember that knowledge is power. Let's keep promoting empathy, knowledge, and support for people on their mental health journey.